Mental health first aid and PTSD. Post-traumatic stress disorder, PTSD, is a mental health condition that can develop in people who have experienced trauma, such as a natural disaster, physical assault, or military conflict. It's normal to feel sad or depressed after a terrible experience, but if those feelings last longer than a month and get in the way of daily living, it could be post-traumatic stress disorder. Examples of PTSD symptoms include the following. Traumatic memories and flashbacks keep popping up, constantly trying to avoid thinking about it. Guilt, shame, and blame are all negative emotions. Having a heightened sense of awareness or being easily shocked. Disturbed sleep, whether from insomnia or bad dreams. Psychological counseling, medications, or a mix of the two are common approaches to treating post-traumatic stress disorder. Cognitive behavioral therapy, CBT, is a form of psychotherapy that has demonstrated success in the treatment of post-traumatic stress disorder. Individuals can learn to recognize and counteract irrational ideas about the traumatic incident, as well as create coping mechanisms to alleviate their symptoms through this form of therapy. Another form of treatment that can help people deal with traumatic memories and the triggers they're associated with is called exposure therapy. People with PTSD whose symptoms include avoidance can benefit greatly from this treatment. Medications such as antidepressants and anti-anxiety drugs can be helpful in controlling the symptoms of post-traumatic stress disorder. Medications like these are useful for reducing distressing symptoms like anxiety, depression, and heightened awareness. There is some evidence to suggest that the use of psilocybin, the active ingredient in magic mushrooms, may be helpful in the treatment of PTSD. One study, published in the Journal of Psychopharmacology in 2016, found that psilocybin-assisted therapy was associated with significant improvements in PTSD symptoms in a small sample of participants. Self-care practices are also essential for PTSD management. A few examples are working out frequently, getting enough sleep, learning calming techniques, and avoiding substances like alcohol and narcotics. If you or a loved one is experiencing signs of post-traumatic stress disorder, it is crucial to get help. With the correct treatment and support, people with PTSD can learn to control their symptoms and lead productive lives. Training in mental health first aid equips participants with the knowledge and skills necessary to identify and help those who are experiencing mental health issues like PTSD. Some of the ways in which learning mental health first aid might aid with PTSD are as follows. One benefit of mental health first aid training is a greater familiarity with PTSD, including the disorder's signs and symptoms and the toll it takes on survivors. In doing so, people can better treat themselves and others who may be showing symptoms of post-traumatic stress disorder. The stigma of mental health issues, such as PTSD, might be lessened by taking part in mental health first aid training. As a result, individuals may feel more at ease reaching out for assistance, which in turn lowers the threshold for receiving care. Those who have received mental health first aid training will be more equipped to help those who are having post-traumatic stress disorder. This can take the form of listening to them without passing judgment, providing them with emotional support, and putting them in touch with resources for further assistance. Individuals who have received mental health first aid training will be better equipped to refer people experiencing PTSD to qualified professionals. In addition to encouraging people to consult with mental health specialists, this may involve making them aware of local resources and support groups. When it comes to one's own mental health and well-being, learning the skills taught in mental health first aid courses can be invaluable. Methods like practicing mindfulness and taking time for self-care fall into this category. People who take care of their own mental health are in a better position to aid those around them who may be dealing with post-traumatic stress disorder. Training in mental health first aid is not a substitute for receiving proper medical attention for PTSD. However, it can equip people with the tools to identify PTSD symptoms and help those who are experiencing from the condition. Thanks for watching. Like, share and subscribe. Check out Mental Health and Life for all your training needs.